worked with the council immunisation program. And did all this side of it, I guess, looking after the air and all the administration side of it. I then went and did my registered nursing and then became a nurse immuniser. And I've worked with the Primary Health Network, when it was previously Medicare Local and Division of General Practice. So I've had sort of, I guess, a broad sort of what would you say, introduction into immunisation. And look, it never stops changing. So, and I just encourage you, I want you to leave with, your questions answered tonight, basically. And air is changing all the time, and I may not be able to answer everything, but I'll certainly try my best to find out for you and get Alicia to get in contact with you. And Steph, are you flicking for me? Okay. Oh, we're off. I can give you a little overview anyway. I encourage you to ask questions along the way because I just really like this to be interactive. And often there's somebody else sitting at the table beside you that's thinking the same thing. And there's never a stupid question. So please ask away, and the same for everybody on VC as well. So what we'll be covering tonight is the history of the Australian Immunisation Register, a day in the life of the register, the importance of air data, accurate, complete and timely data, just some of the enhancements recently that have happened to air. I'll talk a little bit about the medical exemptions, contraindications and natural immunity and recording those on the air because we've had some changes with those of late. Recording adolescent vaccines on the register. I won't cover a lot on the air reports, but I've brought some samples along with me and if anybody, does anybody here download overdue reports from the air? No. You do? Yep. So a 10A report, is that what you order? Yeah, yeah. So we'll talk a little bit about that as well. And you probably know more about the 10A than I do. But, you know, look, it's just useful, I think, to share that knowledge and network with the group. And then we will have time for questions afterwards. But again, I said if you can ask questions along the way, that would be great. Thank you. So, okay, that's great. So the history of the Immunisation Register. So the register itself commenced in 1996 and it was originally just a childhood immunisation register where you could record vaccinations from birth to 7 years of age. Once a child turned 7 years of age, you couldn't record anything on the register. And that came about as part of a 7-point plan that the government brought in to address low immunisation coverage rates within Australia. And as part of that 7-point plan, they developed the Immunisation Register. We had a massive change as of the 30th of September 2016 when we used to refer to it as the ACER when it was the Childhood Register, but now it's the Whole of Life Register. So 30th of September 2016, the ACER expanded to become the Australian Immunisation Register, which we all refer to now as the AIR. It's a national register that records immunisation given to people of all ages in Australia, so it's a whole of life register. It wants to go to the computer, does it? Which way am I going? Backwards? Forwards? No? I might get you to flick. It seems to have a little rest and then it doesn't like to continue on. Just wait for that next one to come up. Oh. I can talk to this next slide anyway. So again, as I said, the AIR is a national register that records all vaccinations given to individuals of all ages. It includes all the national immunisation program vaccinations, so all the ones that are provided free across Australia. And then we've also got adult vaccinations such as flu, adolescents for, you know, secondary school immunisation program, and adult vaccinations such as shingles, and any travel vaccines can be recorded on the AIR as well. The other thing there I think that's critical too is that any overseas vaccinations that have been given can be recorded on the AIR. So just so you know that. So the AIR is administered under the Australian Immunisation Register Act 2015, and the AIR data is protected under the Privacy Act 1988. The next slide. Beautiful. So as of the 31st of December 2018, we had over 26 million individuals of all ages registered on the AIR. So that was up, increased from 6.2 million when the register became a whole of life register. So can you imagine the workload that came with that? It's fairly significant. 94.6% of 5-year-olds were up to date with their vaccinations, and that was up from 93.4% in September 2016. And on that note, I think just to acknowledge that Gippsland here, the PHN catchment area, has a coverage rate currently of it's over 96%, so which is for 5-year-olds. So that is fantastic, and that's a credit to all of you that are working in the field. I'd like to also, sorry, I forgot to do this at the start, just to acknowledge Tracy Hibbard and Lauren Dalton. Tracy Hibbard's, she is the manager of AIR, and I think Alicia was trying to get Tracy or Lauren Dalton down. I think they're both they reside in Sydney, so they couldn't come down to do this presentation. And Tracy and Lauren have really supported me with a lot of this information to put into this presentation, which has been fantastic. And particularly this slide here. And I just think, you know, when you ring AIR to get something changed and you're on hold and you're thinking, will you hurry up, you know? But I think this is just really good because it gives you an idea of what's going on in their world. And I think it's really important that we all recognise that. And after I saw this slide, I thought they actually respond pretty quickly considering the workload they've got. So this is what happens at AIR in a 24-hour period. So they've got over 43,000 immunisations that are submitted through the practice management software. So that's just from GPs. It possibly comes from local government as well, but it just says practice management software. Just under 9,500 immunisations are submitted through the AIR site. So that's where you actually log on and go in and put them in yourself. And then they've got 67 immunisations that are submitted manually. So some practices, for whatever reason, haven't quite converted over to the electronic data recording. Of those immunisation encounters that are sent up, just shy of 5,500 of those, so it equates to 10%, are pending transmissions. And I'm sure everyone in this room has had a vaccination that is pending. Now, I don't know, I think the most common one that I've had recently is the 4-year-old immunisation, where it recognises the DTP as dose 5, but because the polio goes through as a dose 5 as well, the dose 4 sits up the top in the overdues. And what happens with those, once you've submitted it through, they have somebody that goes through that just works on those pens every morning. So once you've submitted the data through, they go through and they will fix it. So the majority of those will be fixed. So and that's something I think that AIR actually, they know it's an issue and they're working with it. But yeah, I think from my understanding of the air and the tech side of it, it's a huge thing to get things changed. It doesn't happen sort of really quickly, but gee, they've made some progress in the last couple of years. Oh, we've got a question. That's a good question. And I'm not sure of the legislation around that. That would be perhaps a question that they could ask the Chelsea Taylor, the Senior Policy Advisor at Department of Health. However, it's just, I guess, once you've given an immunisation, it is an expectation that, and you have to have that on your information too, on your privacy policy, to say that you will send that information up to the air. And because we've got family, yes, no jab, no pay nationally, and no jab, no play in Victoria, it's critical that those immunisations are recorded. Yep. So just some of the other things that happen in AIR in 24 hours, they get 638 phone calls from individuals. So that's just from parents. And about 40% of those are requesting their child's immunisation history statement. And we'll talk a little bit more about that in this presentation. 23% are inquiring about vaccines that are not recorded on the air. So obviously they've been stamped in their book or whatever it is, and they haven't gone on to the air. If they obviously can view their statement. 475 phone calls from providers, so that's just from us. 58% of those are requesting to amend data already submitted to the air, so it may be that it's an incorrect dose number or something, or we've clicked Infinrix instead of Infinrix Hexa or whatever it might be. And 12.4% are requesting air site help. And it is a bit, if you're not sort of, haven't had a lot of education around it, and often when you go into, particularly within a practice, and you've got multiple things that you're trying to learn, the air site, you know, is just a number of things that you have to learn and usually learn very quickly. So it's great that they have that help section as well. They have 544 forms that were processed in one day. 26 of these were manual encounter forms submitted to the air by providers, and 24% were immunisation history forms used to report overseas vaccinations to the air. Once a month, providers also get a statement from the air, and that's, vaccination providers are paid based on the number of vaccinations recorded on the air. So that probably goes through to the practice managers. Does anyone else check that statement when it comes through at all? Yep. Yeah. So you could run a report against your software and make sure that all of your encounters have been paid for, so your notifications fees would be paid for. Vaccination providers request reports to be generated through the air site. So I know I order them through the PHN, I order them through local government, and then it can be that practices can order a 10A as well, so they have to process those. And air data is sent to families for the family tax benefit and the childcare subsidy. So they, you know, when you look at it, there's a lot of work there in one day. So the importance of air data, excuse me, can I just... So the importance of air data. So the air data is used to monitor vaccination coverage across Australia. It's used to monitor the effectiveness of vaccines and vaccination programs nationally. It's also used to inform immunisation policy and research, to identify any parts of Australia that are at risk during disease outbreaks. And I guess given that we've had quite a few measles notifications, this is where the air kicks in as well. The eligibility for family tax benefit and childcare subsidy payments. And I'm quite sure everyone in this room has had somebody that turns up to the counter and they want to know why my immunisation is not up to date, because my family payments have been cut off. So, and sometimes it may be that the encounter's pending, or whatever it might be, it hasn't gone through. Sometimes it may be that particularly if they're a first time to your clinic, you need to make sure that you've got all the information correct when it goes in, because if that's not correct and if they don't have a Medicare number recorded next to it, sometimes it can create a duplicate history, and they might have two histories sitting on the air that are partially sort of, or two incomplete histories basically. Once you merge them together, they come to a full up-to-date immunisation record. It's also used to, as I said, monitor vaccination coverage across Australia, to monitor the effectiveness of vaccines and vaccination programs. Sorry, I'm going over the same one here. Sorry, this is the one I wanted. As proof of vaccination for entry to childcare and school and for employment purposes. And that one is really, I've been finding that we've got a lot of people that are coming in wanting, particularly if they work in an aged care setting or childcare, they want particularly their flu, they want you to, you know, print out something for them. And I usually use that as an opportunity to educate people to say you can actually get that online through your MyGov account, which I'll talk about that a little bit further down the track. Does anyone have any questions so far? Yes, absolutely. So it actually, the accurate, complete and timely data assists vaccination providers with data entry. The AIR system has been updated to include enhanced identity matching for individuals. And that's what I was talking about, where sometimes when you get a duplicate history on the register, they've got automated business rules, real-time processing of data entering using the AIR site, and that's been really good. I use that a lot now if I'm, particularly for overseas immunisations, if we get somebody that comes in, we have an abattoir in our area down in Warrnambool, and often we'll have parents that turn up and they've come over on a 457 visa with small children, and both parents might be working, and they can't go to work because they can't get their child into childcare because they can't get anyone to put the overseas immunisations on. And if you can go on and put those on, you can actually then print them out a history, give it to them, and off they go. So that's really useful for parents. We've got the additional standard vaccines that have been included, so the likes of meningococcal ACWY, so the Nimenrix and the, sorry, Menactra, thank you. It wouldn't come to me. And then we've got the Gardasil vaccine, Gardasil 4 and Gardasil 9 for the HPV. And we've also got the pharmacy and commercial vaccination providers as well. Yes. So the automated business rules are basically, I don't know a lot about them, so it's probably more a perhaps something that we can ask Lauren about, which I may get Alicia to follow up on that. I don't know the sort of finer detail of those, but they are, I guess it's like it's automated as such, as it's updated every day. That's my understanding of it. Yeah. So they've also got improved, as I said previously, improved identity matching and the amended Indigenous information. Now you can update an individual's record with a returned mail flag. Are people aware of that? If you've sent out a reminder and it comes, like it may be a letter, and if it's overdue for an overdue immunisation history, and if it's got comes back to your clinic with a return to sender on it, you can actually update the AIR with that to say that it's returned mail. What it does is the address actually will just completely be removed, and it'll have null written there. And then it is up to the parent to go in and fix that up. But if you can identify that they've moved on, you can update that on the air as such. You can amend, correct vaccine data that they have submitted. So I'll talk a little bit more about that in the future slides. Notify natural immunity and medical contraindications. So you can do that online. Previously, we just had a paper form that we used to have to send in, but we can do that online now. We've also got the recording batch numbers and school names for all vaccines. So anyone who's working in local government, does anyone use IMPS here? Yeah. So once you send all your information up through IMPS, so IMPS is a software program that's used by a lot of local governments within Victoria. I think there's only about 3 local governments that don't, and I think they used it over in South Australia as well, but I believe they may have changed over to a new program, which is going to occur here as well. But once all of that data goes up, it actually records the school. So when you go into a client's history, you can see the batch number and you can see the school that it was given at as well. You can record planned catch-up schedules, and I'll speak more about that because I've got some screenshots for that. And the wonderful thing is that you can print immunisation history statements as well. And particularly with that real-time live data going in. Yeah, we've got a question. Yes. Right. Yes. I don't know. Okay. Okay. Yeah. Right. Yes. Yeah. Yeah, okay. I'll just, for the people on VC, I'm just going to repeat the question. So the question was, can Q fever vaccinations, or currently it can't be recorded on the air? And I was unaware of that because we don't give Q fever. So it's not in the other box when you go down? No, not at all. Okay. Right. Okay. Okay. Yes. Okay. Yeah. So that is probably something that I'll get Alicia to actually ask Tracy or Lauren and to raise at that national level to look at that. Because as you say, particularly for rural areas, it is an issue because you certainly don't want to revaccinate somebody. I know they do the skin test and everything, but you know, if you can go onto a register and have a look, I mean, ideally, you know, a whole of life register, that will be great to have on there. So. But I know Tracy will be able to answer that question. So I'll get Lauren to, get Alicia to follow up on that. So just in regard to keeping that information going through to the air accurate, complete and timely, practices need to keep their practice management software up to date for access to the latest air, Medicare and PBS functionality. And I think if there's anything that you take home from this, if you're working in a general practice, because I do see this a lot, where they haven't applied the latest patch and it might be changing the dose numbers or it's blocking something. So when you go back, just sort of, you know, talk to your practice manager or whoever it is that's responsible for keeping that up to date. And it's the same with local government, just making sure you've got the current version of IMPS on there as well. Submit immunisation data entry to the air as soon as possible, and ideally at the time of service. I know time and time again when we do our childhood clinics, you know, parents are always saying, when will this go through to the register, you know, because they usually want to print off their statement, or their family payments have been cut off, or they need to get into childcare, or they need to enrol for kinder. So, so if you can get into, you know, into the groove of just sending that through as soon as possible, that's the best thing. Immunisations are recorded in batches when using practice management software. And immunisations are recorded in real time when using the AIR site. So if you've logged into the AIR with an authentication file number, you're on real time. So once you put something in there and submit it, that's on real time. You can go in then and view their history, and it'll be on there. And the immunisation history statements can be printed from the Identify Individual menu. So I'm just going to, I've put some screen dumps in here. One of the other ways that I notify, sometimes if I haven't got time to be on hold to AIR, do many people use the secure mail site? No. Sorry? Yeah, and it's really good. So you can, and often what I do, if you've got sort of, you know, your two screens, you can just copy the information off the site and then dump it into the copy and paste into the actual secure, and it just saves you having to type all the information out about the individual and then put what the issue is, you know, can you update this to a dose 5 or whatever it might be. And they're really good, and they respond. Yeah. So you just go into once you've logged in, you just go into the secure email down here, and then you just click on new email, and it automatically, because you're logged in as a provider, it will automatically recognise, because you're in AIR, it says, oh, this is Dr. Brown from Gippsland, and he's telling me that that dose number needs to be, you know, number 5. Yeah. So you can post that, and then you can go in and just see if it's been answered. So, yeah, it just depends. Look, if you've got somebody standing at the front counter, yeah. It probably is. If you've got them in there, and I ring, yep, and I say, look, it's changed, you know, and they go off happy. You can print a certificate, whatever it might be, or they can bring it up on their MyGov account and view it, and they can see that it's done and everything's sweet. You know, they might ring in and just say, and if they're not in a hurry for it to be changed, you can just quickly jump on and do it through there. Yep. Does anyone need a coffee or a water or anything? Because we can have a little break if anyone needs a... Everyone's good? Happy to keep going? So I just want to have a closer look at the AIR enhancements. So I've just sort of covered some of these in those earlier slides. So this is the screen dump for the return mail indicator. So this is where I was saying, if you get somebody who you know that they don't live at that address through a a return mail, you just click that box there and just go save, and it'll remove the current address that's on there, and it just says null, and then they can go, the parent can go back in and update that. Yes. I don't believe it does. It's actually the parent who has to update the address. So if you ever go on to AIR, sorry, for the people on VC, that question was, if you find an address that then a person's not living at and you immunise them, and then you update their address in your software and send it up, does it automatically update it? I'm actually a little bit unsure about that, because I think they have to change it. Yes. Yeah. Yes. It is through Medicare. Yep. Yes, because if you look at, yeah, that's right. Yeah, they can log into their MyGov account or go into Medicare. Yeah. That's my understanding of it. So the other thing is that if you're planning, so if you've got somebody that comes in that's overdue for immunisations and just say that their payments, their family payments have been cut, and you've put them onto a catch-up program, but so you can't administer all the overdue immunisations on that day, obviously because they might need 2 doses of MMR, so vaccine, so you're going to have your 28 days apart, etc. You can click the box here. Do many people know about this for planning catch-up overdue? No? Yes? Yeah.
Because if you did it, then you would have, they would sort of, that would trigger if they didn't turn up on the
Yeah.
day, but like they were a week late, then you trigger a whole lot of.
Yeah. So basically what that does is once you click that box, they get 6 months to have all the immunisations given. So if they have, you know, a couple today and then they don't turn up for another 12 months, they don't come back, you haven't got anywhere to go with it. So you need to be really sure that you can get all those catch-up immunisations given in that 6-month time frame. So yeah, so basically vaccination providers can now record planned catch-up schedules using the AIR site. The vaccination provider should not put the individual on a planned catch-up schedule if they have vaccinated the individual and the individual is no longer overdue for any vaccines. So if they turn up and you give them all the overdue ones, you don't need to click the box because once they've gone through, their family payments will commence, or they feel that the parent or guardian of the individual does not intend to vaccinate their child, and that's probably what you're referring to. Yeah. You can't. No, you only get one go at. Yes. Yeah. That's right. Yes. Yes. Correct. Yep. Yep. So Centrelink knows that child has been to a provider and they've put them on a catch-up program. So they've got 6 months to get all of those overdue immunisations up to date. Go to the next one. Oh, sorry, we'll go to the next slide because that actually covers all the same things on that one. So this one here, so this is just updating counters. So, and you can't do this if you submit, the majority of you probably put it on through practice management software. So it goes up in a batch and then it's processed at the AIR. But if you're doing it live, and particularly with overseas immunisations, I actually use this little pencil on the side here a lot. This one here. So when you put something in and it comes up and it'll, you know, like this, and if the pencil's there, it actually means you can edit it. So because it hasn't been processed by AIR yet. So once it's processed by AIR, you can't change it. You actually have to ring up and get the dose number or the vaccine changed. But if it's got that little pencil there, you can just click that and then you go, oh, they had, you know, afluria quad, or, you know, I clicked the wrong one and it was dose 1. So you can amend it from there and check it. And I just find it's really useful with overseas immunisations because sometimes they can be really tricky to encounter. Yep. Yeah. That's right. Yes. Yeah. So you're no. So you're on the site. You're on the AIR site live. So do you do that? Do you log into the actual AIR site? Yeah. Okay. Yeah. So. Yes.
Well, we've only done that with
Yeah. Entered it. So when you put another one of those in, just have a look and you'll see when you go, you know, yes or whatever. I can't remember the steps it goes, but it will have the little pencil down the side, and you can click on that, and then you can edit it, and then you go submit. And once it's processed by the air, you can't go back in and change it on the site. You actually have to ring air and get that changed. But it is really good. And 10% of the incoming phone calls from customers and providers are from providers requesting to amend data on the air. So it's just really good that you can sit it there and have a look and go through it, because you can. I think you can put I found a maximum of 10 encounters in before you can submit, and then you submit, and then you have to go in and do another lot. Yeah. So we've got providers access to immunisation history statements online, and I was pretty excited when this came up. Just a bit sad, really, isn't it? But down on that box there, so if you go on live to the site, you just click on this box here, and it will bring up, you download the file, and it comes up like this. And it tells you everything that's been given. It has the immunisation status up here to say that the child's up to date, and then their next immunisations are not due until 2021. So that's been just so good for us as providers. There's something else I was going to say about that. Oh, the other really good thing that I do on that too is, so if you've got, say, a parent at home and, you know, they can't access their MyGov account or whatever it might be, you can email that very easily from there. So I think you just click on it and it goes send via email, and it just attaches to the email that you've got in your system, and then you can get their email address and send it off. So it's very good and very useful. I don't know. Chelsea Taylor will be able to answer that question. So we'll get Alicia to, if they've got a doctor that's got, he's an immunisation provider, it would be a yes. Yeah. But as a department, I don't know. Yep. So we'll go to the next slide, this one. So this is the parent access to the immunisation history statements online. So this is really useful for parents. So it's just, you can download the app from the App Store. Do many people know about this? Yeah. Yep, I've got it too. I actually downloaded it because I'm telling people that they can get, you know, you can get it on your phone, and I'm thinking, and I don't know how to work it. So I downloaded it, and yeah, I thought I was pretty clever. Yeah, that's right. Yeah, I try to do mine each month so I don't forget. But it's just really useful to be able to pull your phone out and show the parents how they can do it. They think that's wonderful. And there's a whole lot of other information. I mean, everything's going online. So, you know, the more you can educate the parents about that, it just helps your day-to-day practice. So they go in, they download the app, and then once it's downloaded, this is what it looks like. The little app on your phone is just, he's the little man in the green with his little bag, and you just click on him, and yep, you can see your immunisation statement. We've got a question on the VC. Oh yes, correct. Yes, sorry. Yes, the parents. That's right. That's correct. So I'll cover just a little bit about the medical exemptions. So we'll just go to the next slide. How's everyone on VC? Can they hear and so forth? Everyone's good. So medical exemptions. So the following groups are eligible to provide immunisation medical exemptions. So like as nurses or nurse immunisers, we cannot provide a medical exemption, or a local government, unless it's our medical officer of health. So the people that can are general practitioners, and they have to be defined by the Health Insurance Act 1973. They can be fellows of the Royal Australian College of General Practitioners, fellows of the Australian College of Rural and Remote Medicine, on Medicare's vocational register of general practitioners, and that includes general practice registrars on an approved 3GA training placement. Don't ask me what a 3GA training placement is, because I don't know. Paediatricians, public health physicians, infectious disease physicians, and clinical immunologists. So they are the only people that can complete a medical exemption. And you can do those online, which I've got some slides up there about that as well. And the same for a medical contraindication. So those same group of providers are the only ones that can put in a medical contraindication. And the contraindications for a permanent vaccine exemption are anaphylaxis after a dose of vaccine, anaphylaxis after a dose of any component of a vaccine, and significant immunocompromise, and that's associated with live vaccines only. So the contraindications for a temporary vaccine exemption are significant immunocompromise of short duration, so for live vaccines, and pregnancy, and again only for the live vaccines. So I just want to go on to recording a medical contraindication. So previously we just used to do this on a form, but if you're a GP, you can now do it online. So you go through and you just work through your way through the steps. You know, you put whether it's permanent, temporary, when the start date is, etc. You can also, if they just like a hard copy of the form, you can download one of those as well. Some of the GPs just like to do a hard copy of it. We'll go on to natural immunity. So an individual has had a disease and as a result has developed a natural immunity to it. They can be exempt from receiving the vaccine. A natural immunity can only be recorded for these diseases. So hepatitis B, measles, mumps, rubella, and varicella. I've got a lady at the moment who I saw last week, and she moved over from the UK, and she's got a child who is 12. She's in year 7, but she's got a needle phobia, and she has had the mum's a nurse, and she's had the child's had chickenpox, but their family payments have been cut because she can't get a natural immunity recorded. They've had 2 goes at taking blood from this child, and it's just been really, really difficult for her. So, you know, there's just some, you know, I said to her, look, I think the only thing you can do is go to your GP and just have another dose of chickenpox vaccine. Yeah. Yeah. But, you know, some of these really tricky situations sort of turn up, and sometimes it can be like hard, and some, you know, I said to her, have you got a photo of the child? Like with the chickenpox, maybe you could take that to the doctor and he might be happy to do that. But this particular lady, her and her husband had separated, and he had all the photos, you know, so she couldn't get access to those either. So it's it can be really hard sometimes for some of these situations where, you know, they might have a natural immunity, and when the family payments are linked to it. So they're just kind of, I guess, some things to sort of think about. Again, we've got recording a natural immunity. So this is the same as the medical contraindication, where you just, the doctor can log in and it will, you know, you just go through and put all the information in there and submit that to the register. So we've got the air data, what you can do. So these are, and actually Lauren from NCIRS has sent me some extra information just before, because she's at a Medicare air workshop in Melbourne, sorry, not in Melbourne, in Sydney today. So she's got the latest and the greatest, and I'll read some of this out. But keep your practice software up to date, which I've already said. To the latest AIR, Medicare and PBS functionality. Ensure all individuals have an updated record on the AIR for childcare, school, employment, travel and family assistant purposes. Send immunisation data to the AIR for all individuals, and just, you know, try to remember to send it really timely as well. I'll just talk a little bit about the AIR and the HPV register. So most of you know that there was a separate HPV register that we used to send the information through to. So that has now ceased, and all of the HPV data has been migrated over to the AIR. So that's all on the AIR now, so you can bring that up. So AIR is now the only register for HPV vaccinations. Due and overdue rules apply for the HPV vaccinations, but just remember that the HPV vaccinations don't impact on the family payments. All HPV vaccinations recorded on the register have, I've covered that, been migrated to the AIR, and the AIR site includes reports include HPV as well, so it'll come up on any reports that you pull down from the AIR. The AIR and adolescent vaccines, again, that kind of talks really about most of the HPV, which I've covered, but it also does, you know, it's actually really good with the boostrix, you know, because sometimes, particularly when students in year 7 with boys, you know, they're out doing things and they might have had a boostrix vaccine for the DTP, you know, in grade 5 or 6. So if that's been put through to the AIR, you can always check that on the register as well. Or often parents, particularly in local government, they might just write briefly on the card, has previously had, but they won't put a date on it. And you can just go onto the AIR and have a look, and that's usually what we do within local government too. So it's really good that all those adolescent vaccines are now on the AIR as well. So with the updates and the whole of life register, the AIR, it applies due and overdue rules for adolescent doses of the meningococcal ACWY, and that was from April this year for dates of birth from 2001, and the DTP, that was from the 1st of January 20, that'll be for 2002 date of birth. As I said, the AIR reports now include adolescent doses on them. And adolescent overdue reminder letters are sent at 14 and a half, 17 and 18 years of age. And these will include any vaccinations that have been missed during childhood. Now, you would think that they would have normally been picked up if the family's getting payments, because the payments would have stopped if a part of the childhood schedule is missing. And increased frequency of childhood overdue reminder letters for non-Centrelink customers. So they go out at 7, 13, 15, 19 and 49 months. And just note, overdue reminder letters for all will continue at 10, 21 and 54 months of age. So that's really sort of handy to know when those letters go out, because as a provider we don't get a lot of information, I know, just in local government about how often reminders and letters go out from Centrelink, you know, because we all tend to kind of work in silos a little bit, I guess. I won't spend, I'm just mindful of time. How are we going for time? Okay, so I just want to talk about a little bit about the AIR reports and what's available. So we'll just, does anyone want to have a toilet break or grab a drink or anything? Yes, we've got a question. Yeah.
Does the Shire send out overdue reminders for adolescents, or is it something GP clinics should be doing?
That will be probably a question. Which Shire is it? Because Alicia might know. East Gippsland? No one's from East Gippsland? No? No. Okay. If they're in Year 7 or Year 10, if they've missed their Year 7 vaccination and they're in Year 8, they wouldn't automatically get a reminder. Well, that's right. Yes, yeah. But the question was, does the Shire send them out? Wellington, does anyone know if Wellington Shire send out overdue immunisation reminders for adolescents? No, but Alicia will look into that. Thank you for the questions on BC. So we'll just go to the next one. So these are the reports that you can access from the AIR site. So you can look along there and see if you're in general practice. You've got a tick there for which reports you can actually access. If you're a local government provider, if you're a public health unit, so like in New South Wales, all of their school immunisations are given through a public health unit, so they can pull down reports. At the PHN, we can access reports as well. Now this slide will be, Alicia will put this up, so you'll get sent out this so you can have a look at it in more detail. I guess given the audience tonight, probably the most common one that would probably be used would be the 10A in general practice. So what that does is give you a report of all the children who are overdue that have attended your practice. So it usually goes by the address of the practice. And I've given Alicia a how-to guide that was developed by, I think it was Sydney PHN. So she's got that, and we'll make that available if anyone's interested in pulling down a report for a general practice. We'll just go to the next slide. I'll just talk a little bit about the 10A report. So it identifies individuals who have attended the medical practice for a Medicare service and are due or overdue for vaccination. Now, a medical practitioner must request the report using their Medicare provider number. The practice must have a PIP program number, so a practice incentive program number. So if you're not a PIP, if you're not registered for PIP, you won't be able to order a 10A report. GPs at the practice must be registered with PIP and have not accepted the AIR terms and conditions. And the 10A is not available for AIR ancillary providers as such. I just know in our area, I guess, because our local governments do a lot of the overdue, particularly with the childhood immunisations, that the practices, and at the PHN, I actually send out overdue reports to the practices. So we don't have a lot that do use a 10A report, but that's purely, I think, too, because they're already getting the information, and a lot of them just find it a little bit, it's another job to do sort of thing. So with everything else that they have to do. So this is what it looks like when you go into to order the report. So you just down the tab on the menu on the left-hand side. Once you've logged into the screen into the AIR site, you just go to the View Reports tab, the Reports tab, and this is where you order the reports. So you can either order it in a CSV single file, so it comes in Excel, or you can order a text file as well. And I have brought some examples just for you to have a look at. This is a text file. It's actually a local government report, but your 10A will come basically like that. And if you order a CSV file, it comes in multiple files, but if you're really good with Excel, that can be really useful as well. Got a question? No, that's okay. Yeah. So I've got a question on VC. And so yeah, so that might be like a local government or like maybe a health service. As in like a community health service. Yeah. So here with the 10A, which one are we up to here? 10A report. So when it comes in the multiple file, you get, as I said, you get a few different Excel files that come. And so it has a file for the individual details. It has another file that has the due and overdue details in it. Then it has the vaccines that have previously been recorded. There's a file that'll have if any of the children on that report have got a natural immunity recorded next to them, or if they've got a medical contraindication. So the CSV file does come in a multiple format as such. So if you've got a lot of kids, it can be a bit tricky to kind of work out. But if you've only got a small number, you can I usually just use the individual file. So you've got the names of the children that are overdue. And if you've only got 10 children on your report, you can just go in and look them up on air directly. And that's what I do, rather than trying to work out all the individual files as such. And yeah, so this is just basically what it looks like when it's when you go to download it and open it up. So they just come in. That's the due, overdue, the individual history, and the vaccine file. So just the three of them there. I'll just quickly go over this one, but this is the local government, which is the 11A report, and you can do it due or overdue by municipality. So there's an 11A and 11B report that within local government that are probably the most commonly used within local government. So the 11A will give you all of the children in your municipality that you want to focus on. So, you might find that your cohort 1 might be, down to 89% or something. So you go, oh, well, they're low. So we'll target those children for whatever reason it might be. So you can put in the age group if you want. So that's what it looks like. So you just click on the 11A and then we'll just go through this. So I usually just put in there, I just click that top box to say follow up individuals who are overdue for a scheduled immunisation. So this is just when you're requesting the new report. And it's a little bit like this when you go through a 10A as well. You just have to put this information in. So we'll go to the next screen, and this is where you put in all the parameters of what you want. I usually order children, I usually make them 3 months overdue, because sometimes it might be just that the data, like there might be a practice that's had a malfunction with their practice software or whatever it might be, and the actual immunisations have been given, but it hasn't gone through to the air. So I usually make it like a 3 month, that's just my preference, so that then you're not following up all these children that have actually been immunised. It's just for whatever reason the data hasn't made it to air. So just to give a bit of lag time for it. And then, like if you just want to focus on, you might want to capture your 4 to 5 years of age. Say if your cohort 3 is down in a particular area, or as I said, it might be your young ones. You might have a pertussis outbreak in your area. So you might want to, focus on children that are under 12 months of age because they're at higher risk. So all of those parameters there, you can fiddle around with those as you like. If you're in local government, you have to put in all your postcodes. That's the only thing. So you've got to put in all the areas that you've got. So usually if you've got them saved to a file somewhere, it's much easier. But again, and it may be like if Alicia's got some information that might come through, or from public health, where if you've got pockets of low coverage in your area, and for something like measles or pertussis, and you want to focus on an age group, you've got the ability to be able to do that. So we'll go to the next one. And then you just request the details, so the address, the details, if they're Aboriginal or Torres Strait Islander, anyone that's had returned mail, and you can get their contact numbers, mobile number, email address, etc., etc. We'll go to the next one after this. Oh, sorry. I'll just go back. So the 11A is basically, it's the same format as that, but the 11B, I should say. The 11B is a local government report, but it will only give you children that have ever been to that local government provider. It won't give you all the children in the municipality. So as part of our public health unit, like in Warrnambool, I always do, I do the whole municipality. And then it might be that I can see what clinics they've been to as well. And even though they don't come to us with my public health hat on, I might ring up Dr. Frank down the road and say, look, you've got little Sarah there who's overdue, speak to the practice nurse. And they say, oh yeah, look, I'll just ring and get them to come in. So yeah, that's usually how I work it. And so yeah, now we've got questions. If anyone's got any other burning questions. No one on VC? Yes? Yep. Yep. On air. Yep. Yes. Yes. Yes, yeah. So the question was for the people on VC was, so when we get students, like they might be a nursing student, they might be, 19, 20 years of age or whatever, 21, and they might have had hepatitis B through the school program, but when, say, in year 7, back then when they had that immunisation, the register was still the Australian Childhood Immunisation Register. So they would have been 12 or 13 when they've had a hepatitis B vaccine at secondary school, but it wouldn't go up to the register because the cutoff was 7 years of age. But you can still go back on and put those on. I think when the AIR expanded, Stephen Palessia from the department was hoping that we would have, from IMS, that we would have been able to extract a lot of that data and send it up to them, and it would have been, processed. But you've got 26 million people that are on the register overnight, and they were just, their workload just increased so much, and I know they haven't had the ability at this stage to be able to do it. But what I do is we actually charge at local government, we charge a $20 administration fee if they want their immunisation history, because of the work that's attached to it. And I know some other local governments do, yeah. Mm. Yeah. Yeah. So, but with that, we will go on and put anyone will go onto the register and put that information on for them, and tell them that they can now get, like, we'll print it all out for them. Yes. Yes. Yeah. Yeah. Good on you. That's great. Great service. Yeah. Well, see, we get a lot of, with nursing students as well, and people going off to uni and medical students, we get a lot that come in and, they want their, they're usually going on placement tomorrow, and they say, but I need it for tomorrow, can you please put it on? And they're usually more than happy to pay $20 to put it on, but it was just a council decision, I said, like, we're just getting more and more of these. And GPs don't have time to put it on. They've got a million other things going on in their practice as well. And if they haven't got a record of it, like, because it's been through local government, and we will often get the practice nurse that will ring us and say, look, I've got, a patient here. She said she's had her immunisations at school. Can you tell me when they were given? So often we'll just give them the dates, and they can put it into their medical history, and then they'll, either put it onto AIR or just print a report out for them. Mm. Yeah. Yes. Yes. Yeah. Because it's a whole of life register. Anything you administer now should go onto AIR, including flu. Yes. You have. You have to put a dose. That's right. Yeah. What practice software do you use? ZMed. Mm. Yep. Yes.
We might have answered just now, but the question was flu vaccination is private. What is the most efficient way to log to air when not a client and workplaces log these?
Workplaces? No, unless they're an immunisation provider. No. So whoever's performing the immunisation, the provider, they would have to have a provider number. So if it's a nurse coming out from a GP clinic, they will have a provider number through the GP. Or if it's a local government, the local government will have a health service provider number. So I just actually want to now, because like everything, IT, nothing stays the same forever. Now, Lauren Dalton from NCIRS, as I mentioned, she's at the workshop down there, and she has just contacted me while I was cleaning my teeth at 5 to 6. That's a true story. So she just emailed some information through to me, just some key points about what's happening at AIR. So she said if it's not a regular patient at your clinic and you don't have a previous history of vaccines documented, don't presume they are up to date with the schedule. Always check the patient record on the AIR site prior. Most common errors reported to AIR are duplicate doses that are reported. The AIR sends updated patient records overnight to Medicare, which is uploaded onto the patient's My Health record, if they've got a My Health record. Some common issues here with Medical Director. Does anyone in the room here use Medical Director? Anyone on VC that's on? Yes? Yeah, okay. So common issues with Medical Director. It does not send immunisation encounters to AIR for patients with no Medicare numbers. So be mindful of that. You need to drop that patient record from the claim and report the encounter to AIR via the AIR site. DVA patients need to have Medicare number recorded. All DVA patients do have a Medicare card. She's got cars there, but I'm assuming she means card. All Australian residents are issued a Medicare card number. Gold DVA card patients may not know this, so they will need to go to Medicare to obtain the number for their GP. Medicare card numbers can also be obtained through PRODA. So that those 2 points there are just in relation to Medical Director. Encourage practices to contact their software companies if they have any issues or suggestions. Check the sent vaccination boxes to ensure successful transmission. So again, that's submitting from your practice management system. And CESPHN, which I'm not sure. Do you know it was CES? Sydney, Southeast Sydney, maybe? PHN has some guidelines on downloading and using AIR reports. That would be the ones that had the 10A. They are happy for you to use, or if you contact Brooke, I've got the details. So I'll send this information through to Alicia and she can put that all in dot point and send it out to you. So Brooke will provide you with a Word document that you can put your PHN logos on, etc. So that's really just for us. And the other critical thing that she mentioned, because there are going to be some changes with PRODA and AIR at the end of the year. I think it actually is starting maybe in September. But it's recommended, or actually I'm going to ask, who logs in with a GP provider number? Yep, so there's a few around the room that do, which is fine. It is recommended that practices request organisation login for nurses to be able to use the AIR, particularly useful recording overseas immunisation histories, because the Proda accounts will be disabled at the end of the year. Now, I'm not right over this. So this is where the GP, yes, yeah, what the GP has. So there's going to be changes with it. So she just said to me that to recommend the practices request an organisation login for their nurses to use to be able to access the AIR. I would ring AIR. So on my next, that last slide, there's a contact number there. So just ring AIR and ask them how you go about it, because I actually don't know the logistics of that. But that she said within the next 6 weeks. So probably she said in the next 6 weeks, get yourself an organisation number to log into AIR, or an organisation login. Because I think it's got to do with the authentication file will no longer be available. Yeah, so exactly, yeah. So if you can spread the word within your practices and any other practice nurses that you know, encourage them to get that organisational login so that the practice nurses can get in there and make any changes or update. Particularly, they can't make changes, but they can update information as such. Any other questions on VC? I don't know. The chemists are, I know the pharmaceutical, or the pharmacy society are working with the immunisation providers in practice currently to get them all onto AIR. So that's a bit of a work in progress. Yep. Yes, for over 16 years of age and DTP. I think it should be. And Alicia can probably, for this area, Alicia can probably answer that.
Yeah. So I don't think here in Gippsland we have a lot of the pharmacies are actually providing the immunisations yet, but through the Pharmacy Guild, they're certainly being encouraged to get their logins and make those recordings into there, because they do know how important it is. Unfortunately, at the moment, I think statewide the figures are not particularly good. So I guess in your networks, speak to the pharmacies if you can, but just try and keep them accountable, especially because, as you say, they're doing measles, and that's going to possibly affect payments and things like that. So, yeah, thanks.
And just back on that with the legislation for reporting again, that's I can't answer that question. It's actually, I would suggest to contact Chelsea Taylor from the Department of Health and Human Services, the immunisation section at Victoria. Yep. Sorry. All right. Okay. Or to contact Alicia at the PHN here, and then she can actually answer those for you and put it out to the wider audience as well. So
if hospitals don't have a provider number, then they can't enter into AIR?
They should have a provider number, and sometimes in hospitals, and I'm only speaking from experience with our Warrnambool Base Hospital, Southwest Healthcare, they have a provider number there. But sometimes, it might be that some paediatric vaccines are given up on peds ward, but nobody knows that they've got a provider number, and that's run out of the pharmacy. So I'd check with, some different sources within the hospital to see if they've got a provider number. Most of them will have. And particularly if they're giving like staff flu vaccines, I would, and they'll have as part of their staff health, I would imagine that they would have a login to record it. Yeah. Yes. That's what she's got here. Well, yeah. Alicia, who does health record here in your PHN? Maybe it's over to you guys. So yeah, I'll give you. I'm just going to read out what this is just what Lauren has sent to me. As I said, 5 to 6 tonight, just that has come out of the meeting today. So the AIR sends updated patient records overnight to Medicare, which is uploaded onto the patient's My Health record. That's what she's told me. But I'll hand. Is that it? Is that correct? Thank you. Yeah.
So a lot of them have never, everybody's under the understanding that they've been registered. If they didn't opt out, they've been registered. But they've got a My Health record. But there's nothing on there. And they don't realise that they've got to get a GP to upload their
Uploaded.
To be able to have something.
Yeah. Yeah.
But they'll have that immunisation record.
Yeah. So it looks like if they've got, yes. Yeah. Any other questions? No, nothing on VC. Thank you, everybody, for your attendance. I hope you've taken something away from this tonight, and I'll be around for a little bit if you've got any other questions. And I hope everyone survives flu season. And thank you, Alicia, for inviting me down. That's okay. And thanks to Sam and Stephen there for your IT and all your skills. And thanks for everyone on VC.